From the WDXY studios in historic downtown Sumter, At Your Service Home Care presents Medical Forum with moderator Jeff Reed.
And good morning. Welcome to Medical Forum on this Saturday morning. I'm your host, Jeff Reed. My co-host, Chris Marr. Dr. Marr, how are we doing this morning?
Good, Jeff. How are you?
Good. How was your vacation, real quick?
It was very good. I took a group of Wilson Hall sixth graders to Camp Canoga.
Okay.
We had had a lot of activities, rafting, hiking.
Now, can we talk about your beard for a second?
Absolutely.
Because I know your patients don't want to know.
It's getting cold here in Sumter now.
Okay. Was this part of the nurturing of...
That helped.
We'll do rafting,
helped
we'll do basket weaving, we'll grow beards.
Absolutely.
Good.
Absolutely.
Now, were there girls on the trip or just guys?
There were. They're separated out very diligently.
So congratulations to those girls on their beards. I hope it was nice.
The girls all have
yours look
beards
good.
as well.
Well, it's testosterone and hormones and everything. But welcome to our show. For those of you listening in for the first time, we talk about all the medical subjects that we have surrounding the Sumter, Clarendon, Lee County. And one of our favorite guests from Tuomey Health Systems is Jeff Fall, who will be visiting with us this morning, and Kim Price, who handles a lot of the overseeing with my good friend Rebecca Kimbrell, dealing with the hospice. So we're going to learn about hospice, palliative care, the Bridge program. And Jeff, thanks for coming in this morning. We'll start with you and the foundation that you worked so diligently with. And I'd love to talk about, I know you've got a great, we talk about golf on here on occasions, and you've got the great golf tournament, the Tuomey Foundation tournament, not so far away.
We do, October 9th,
correct.
About 3 weeks.
How's it looking
yesterday.
on sign up and everything? Or do we have it's always a great tournament for anyone listening in. Best prizes, great food, great golf. They get us in, they get us out. We start in the morning, have a great lunch, and then, off to the high school football games or what have you. So
right.
Give us a little rundown of the tournament times and everything.
Well, this year will be similar. We did push it back a couple weeks, as you know, and we hope the weather will be just a little milder and the course conditions will be a little bit better. So we are, I would say, right on schedule with our team sign-ups. There's, I don't know, maybe a half a dozen slots left. We always try to fill it up. That would be 36 teams. So I think we're right at 30 or so. Well,
if someone's listening, the format's Captain's Choice.
Captain's Choice.
And give us kind of the handicaps and the minimum, maximum amount of handicaps that you need. So somebody listening in may say, man, I don't have a team, but I'm an 18. Are we looking for more scratch golfers, do you think? Are we looking for 10 to 15? Are we looking for the 30 handicappers? Do you got any numbers right now for anyone listening in?
Well, you realize, Jeff, this is a recruiting notice for
Maybe
Jeff
I should
Reed
ask
here.
him who he has selected for his team.
Well, I can't give that yet.
And
it
who he's ready
depends
to
on
dump.
how Spieth putts, because if he's 30, we may have
That's right.
Jordan Spieth as our steeple.
You may need him.
Yes. No. But
we say that we want the minimum handicap to add up to 60.
Okay.
So that basically means most teams could only have one really good A player. We like for teams to, try to come in there with an A, B, C, and D player, as you would say in golf.
Right.
So that everyone has a pretty fair chance. But, at the end of the day, all of that doesn't matter so much. There's not a grand prize for the winning team. We do give prizes for the first 3 or 4 spots, but one of the features of our tournament, I guess, is all the prizes that we have, and oftentimes the grand prize is not given to the winning team, but we just do drawings once we're finished. Flat screen TVs, trips to the sanctuary, for example. We have
unbelievable golf course.
Yeah, it's a great place.
Unfortunately, I'll have to say I've heard that. I've never played it, Chris. Have you, Dr. Marr?
Played
Sanctuary?
Kiowa, but I have not played the Ocean course.
Yeah.
It's beautiful. And, of course, a lot of courses right there on the island are very nice. But we do have a package for the sanctuary, and we have flat screen TVs, all kinds of clubs, putters.
Great gift certificates.
Tons of things.
Yeah.
Too many to mention. Last year it was over 100, and I think we'll probably surpass that. So
well, I probably play 5-6 tournaments a year that are in this format. None better. And you guys put on such a great show. You got great sponsors. We got food on the course, Chick-fil-A, Arby's.
Correct.
So you bring the community involved. Who's the lead sponsor this year?
This year it's going to be our good friends Guido Hobie, Guido and Rita, M's Kimmy.
Right.
And they really stepped up to the plate. They're going to be our presenting sponsor. So we're going to have a lot of fun with that. And of course, again, there's tons of sponsors, lots of supporters, all of our business partners, like yourself, your company that does business with Tuomey, has supported us now for, this is our 17th year, wow. And many of the teams and companies have been with us from the beginning.
Right. Well, it's such a great tournament. Now, for anyone listening in, it's Friday,
October 9th.
Tee time is
9 o'clock. So we'll start at 8. We have a little pre-tournament ceremony, and we have breakfast and sign-ups, and everyone wants to get there in time to practice a little bit. So,
get a little snack on the course, get a great meal prepared by sunset. And I will tell you this, I was on the course the other day, and it's immaculate.
It really is.
The rough's high, so it's going to be tough. So you better keep some balls not so far off the beaten path.
The rough is very difficult. Greens are beautiful. Again, we still got 3 more weeks to go, but it is in really good shape. You know, the next, yesterday was the chamber event.
Right.
And it's a really busy time out there. And
200 people. Yo.
Each week, the course, we'll have a lot of play, but it also gets better and better. This is the time of year that they can really make it look nice.
Well, anybody who wants a great golf tournament, call Jeff. Jeff, a contact number, how they can get a hold of you to and better act on it quickly before these openings do go away.
Yeah. Getting close. So 774-9014. Send us an email. We're on the web, or stop by the foundation office there on Hampton and Main.
Well, if you miss it, you miss something great. And as we come up on our first break, we got about a minute. Let's talk about, before we look up, it's going to be Christmas. And I know with Kim Price in here, with Hospice, and both of you, something near and dear to your heart is the Festival of Trees. So as we come up on the first break, maybe tease our audience just a little bit here and tell us about the Festival of Trees. And as we come back from the break, we'll talk more about it.
Yeah, we've already started having meetings for our Festival of Trees. That'll start right after that first weekend after Thanksgiving and run all the way through January 1st or 2nd. We're looking forward to the 16th year, I believe, on the Festival of Trees and the Circle of Lights event. All of that is proceeds go towards our hospice program that's led by Kim Price. You're getting ready to hear from her some.
That's a great tease. And we're coming up on our first short break, and we'll be right back with Kim Price to talk more about it. Thank you, Jeff.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When you buy home and car insurance, you'll receive a multi-policy discount. And when you buy life insurance, you'll get a special discount on your home and car insurance. Auto Owners will save you money on all of the insurance you already have. Now that's good policy. This is Sandy Wilson with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
After my surgery, I heard my children discussing their fear for me to live alone. I wasn't ready to give up my home and freedom, so I called At Your Service Home Care, and now I have my own concierge. It's owned locally by medical professionals. They work with me to make sure that I recovered from my surgery. Now I can stay at home and I have a new friend that I enjoy spending time with. If I need help around the house or have insurance or legal questions or just getting to my hairdresser, they help me with it all. Call At Your Service today for your free consultation, 607-9677.
Reliable Medical Equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street, voted best prosthetic and orthotic business for 7 years.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
This is Medical Forum, presented by At Your Service Home Care.
Good morning again to you on this Saturday morning, and we're coming back here with Medical Forum. We have Kim Price and Jeff Fall from Tuomey Healthcare, and just remember, the Medical Forum is sponsored by Reliable Medical. And Reliable Medical really provides a good hometown supplier, a good and excellent hometown, great, fantastic hometown supplier for all of your durable medical equipment, prosthetics, orthotics. Richard takes care of everyone over there for prosthetics and orthotics. Aubrey will help you with all your respiratory needs, CPAP equipment, CPAP supplies. So go over and see Reliable Medical. 246 Broad Street. Telephone number is 934-9212, but also remember their Manning location, 37 West Rigby Street, and the telephone number is 435-9927. So 2 separate phone numbers there. And we're talking with Jeff today about some of the foundation's events that are up and coming. We talked about the golf tournament, which Jeff has got he's working on the engraving on that trophy. He said there wasn't.
There's going to be a different Jeff, I'm afraid, on it, though.
We put the first name on there.
So we've got the Jeff. I think we can just, Kim.
Well, next year, him and I will just play the field.
Jeff on there.
I think so.
And I think we're probably going to walk away with the tournament.
I would agree, and that's
we'll
only because I'm not playing.
And we'll see. Yeah, right. Absolutely. So
go
ahead and let the engraver know. Let the engraver know that we can put a Jeff on there.
Yes.
And then we'll fill in the rest of it afterwards.
There's lots of Jeffs out there, so that's probably easy.
But as we left the last break, we were talking about the great event that you have through your hospice with the Festival of Trees. So. And Kim Price, thank you so much for coming in as well.
You are
this
welcome.
Morning, and we're going to be talking about hospice and all the to-dos with them. But Jeff, you and her, this is something you guys kind of work together on between the Found Hospice, and I know a lot of the funds go towards that. Explain to people the Festival of Trees, and I think a lot of people may be familiar with seeing the trees through the hospital that are there. So.
Right. Yeah, the Festival of Trees is a program that we've had for, I believe this would be the 17th year, where we go out in the community and get individuals and businesses to sponsor a tree, and then either they or they get one of their other partners to decorate the tree. And every tree is decorated in a different theme, and then we have one large tree, our Circle of Lights tree, that Kim has all been so privileged to decorate for us every year.
Kim is getting old.
It's
a really tall tree.
Yeah, that tree has got to be 30 feet tall.
Yes.
If you haven't seen it,
where's it located at?
Right in the front lobby.
Let me help you with that.
Okay, Kim.
Okay,
please.
so it has always been on top of the gift shop. So not only do I decorate a 30-foot tree, it is on top of the gift shop, and I have no harness. I'm just wow.
Insurance, though, with Tuomey is pretty good, though,
nervous.
isn't it?
It is.
Okay.
I really get nervous
Workman's
at first.
comp, especially.
And then you just get so busy decorating the tree that you forget where you... But, however, last year they were very nice to me. They decided they wanted to keep me around for a while, so they moved it down to the floor. So I even had Jeff and Les help me undecorate last year. They were willing to come and get up on the scaffolding and help me undecorate since it was on the floor.
Now, this is a 30-foot tree, correct?
It's huge.
Wow.
It's donated by the Cannon family.
Yes,
nice.
if you haven't seen it, it's I don't know of any other tree that size in Sumter. Never seen one that large.
It's not New York.
It's not, but it's close.
Yeah.
I thank Dr. Cannon for that tree every opportunity that I get.
Yeah.
Well, let me ask you this.
Sure you
Where
do.
did that idea come from? 17 years we've been doing it. So we were talking about, back in the late 90s to have trees. Do you guys know? I mean, it might not be a fair question.
I cannot answer that because I wasn't here.
I honestly think it started with Circle of Lights.
It did.
And it branched out from there. But
Dr.
I'm
Perry
not really
Davis.
Sure where exactly it came from. I do know we started with Circle of Lights, where you would just buy lights in memory or in honor of a loved one that passed away, and then it ventured into the trees.
Well, we have sponsored. It's a great, if anyone's listening out there, particularly if you own a business and you want some great advertising, November, December, what have you, maybe explain to them. But for us, it's a tremendous, what's the cost? Where do we put them? How big are the trees? And then, Kim, I think one of the things that you guys deal with is finding people to decorate them. And if you're looking to advertise and put a little bit of work in, not to the magnitude of your 30-foot one, right? These trees aren't 30 feet. But you can get some great promotion from it and team with someone who maybe has the funds to support by the tree, and then you get a, for lack of a better word, piggyback by decorating it, and you get great promotion out of it. So maybe explain, how do they get a hold of you if this is something that they're listening and will have some interest?
Okay. Well, the trees, if you want to purchase a tree, the trees are a $1,000 donation.
Okay.
Proceeds go to hospice. That person's name goes on the sign. That business name goes on the sign. However, many of the donors don't have the time or would prefer to have somebody else decorate. So there is also a decorator of the tree. If it's not the purchaser, someone else will decorate it. And to decorate a tree is at no cost to the decorator. It's just that it's the benefit to the purchaser so that they don't have to come in and decorate the tree. That person's name goes on the sign as well. So to be bought by whomever, decorated by whomever. So your business name would go on the tree. Every year we have an array of different trees that go from the themes of children decorating, art classes decorating, to florists decorating, and some of them get elaborate.
Over the top.
It's amazing.
The business and industry, they will decorate in their own theme. BD, for example, uses all their little products. And Continental Tire, they had little tires hanging on their tree. So they, it's fun. It's good for our staff, the patients, the visitors. That is probably nearly a 6-week period of time that they're
Well, let's talk
set
about
up.
that. When you sign up to register for a tree, do we have a deadline?
It's open now.
It is open now.
And we try to accept them for as long as they'll come in, up until I believe is it the 20? It's Sunday
right around
after Thanksgiving.
Yeah.
The Shaw comes in and puts the trees up for us.
Because I think on the 29th the trees need to be up. Is that correct?
Correct.
November 29th.
Right. Shaw will come in and help us with that. They do every year.
Yeah.
That's great.
They do
And
awesome.
maybe for the next show, we'll have some history and background information on how it evolved into where it is. But now we have, year to date, probably raised right at $1 million for our hospice program.
Well, and correct me if I'm wrong, because I do a little bit of research, and I think last year you had the most trees.
Every
52?
year, yeah.
Is that even an accurate number?
Close.
It was something you had well over 50. So if you're not doing this, you're missing out.
Yeah, and we actually raise a good bit more money than that, but just send us money and say, put it towards the hospice tree program. We don't have time to decorate. We don't have to put up a tree for us. Just, this is what we want to support.
Hey, we're coming up on a break. I want to let everyone know, Medical Forum. Also, if you're catching this, the end of this show or what have you, and you want to hear it again, it re-airs on Sundays from 2 to 3. And I also want to let everybody know next week's guest will be Karen Schwartz from Bynum. And we'll be back more talking with Kim Price and might get a little out of Jeff as well.
We'll be back with Medical Forum, presented by At Your Service Home Care on Sumter's home for news, talk, and sports. WDXY 1240 AM and 105.9 FM.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When you buy home and car insurance, you'll receive a multi-policy discount. And when you buy life insurance, you'll get a special discount on your home and car insurance. Auto owners will save you money on all of the insurance you already have. Now that's good policy. This is Karen Schwartz with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
After my surgery, I heard my children discussing their fear for me to live alone. I wasn't ready to give up my home and freedom, so I called At Your Service Home Care. And now I have my own concierge. It's owned locally by medical professionals. They work with me to make sure that I recovered from my surgery. Now I can stay at home and I have a new friend that I enjoy spending time with. If I need help around the house or have insurance or legal questions or just getting to my hairdresser, they help me with it all. Call At Your Service today for your free consultation, 607-9677.
Reliable Medical Equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street. Voted Best Prosthetic and Orthotic Business for 7 years.
This is Medical Forum, presented by At Your Service Home Care.
And we're back with Medical Forum. Medical Forum is also brought to you by At Your Service Home Care, your concierge steward guide to home care and beyond. Great group of concierge and attendants over there at your service, ready to take care of patients who are interested in staying home, staying out of assisted living, nursing homes. Clients who are not interested in leaving their home, leaving all the things that they're used to, and just need some extra help around the house. So give them a call over on Wilson Hall Road, 1250 Wilson Hall Road. The number is 607-9677. So we're talking with Kim about our 30-foot tree that we're about ready to put up. And the 30-foot tree is not going on the gift shop this year.
No,
okay,
not
so
this year.
so we're
Kim turned 35 last year and said enough.
Yeah.
Is that true?
Absolutely.
Some of it?
Mm-hmm.
Yeah.
Mm-hmm.
Enough,
Absolutely.
at least.
Enough. I am way too old for this.
Well, now let's talk about this, because to do this, and you can't be doing it alone. So let's give some out there to some of the people that you work with. So this is and for anyone just listening, we have Kim Price from Tuomey Home Health Hospice. Does a great job, and one of their big fundraisers for the year is the trees that they set up, and there's great sponsors, 50 sponsors last year or more, and you've done this for 17 years. It's a great way for the community to support the hospital, to support the patients in the hospital, but it's also a great way to advertise your business, and it's a combination of not only sponsoring the tree, but then also finding a sponsor to help decorate it. You work with a couple people that you'd like to mention that really help make this a tremendous service.
Well, Grady Locklear is the chair of our committee for Festival of Trees and has been for years. So he is vital to that campaign every year. He does a wonderful job. He has a huge heart for hospice, experienced the hospice benefit with both his mother and his father, and just has a love for the program. Rebecca Kimbrell is the hospice manager. She's the real chief in charge. She does the day-to-day yes, you can have this. No, you can't have this. Yes, this patient is appropriate. No, this patient is not. And I do not know what I'd do without her. So I would have to absolutely give kudos to Rebecca Kimbrell and make up for the fact that Jeff couldn't remember her name at the last meeting.
Well, it wasn't that I couldn't. We had a great meeting talking, and that's what we're going to talk about the rest of the show. We're going to talk about Tuomey's home health and hospice, and I was fortunate enough to be able to speak in front of 30 or 40 of their finest, and sometimes not to take Rebecca for granted. She does such a great job, and we've had just a solid relationship. But as I mentioned to other people, Dr. Moore, I failed to mention her, and she wanted to make sure that I understood not to do that again.
And that she does run that show.
So she does run it.
I'm going to say Rebecca Kimbrell. Rebecca. So now we've covered it for now.
She'll forgive you now.
But now on a serious note, because I think great fundraising and great the way that Tuomey and the foundation and between the golf tournament and the Festival of Trees, a lot of money is raised, as Jeff alluded to, and they go to such great purposes and help all the other nonprofit organizations. But we would be crazy not to sit and talk about home health and hospice. Dr. Moore, Kim Price, the two of you probably know more about this area from working in it and then directing it. So let's talk about that for the people out there. Let's just take, Kim, the subject hospice. How would you describe that? What is hospice? We've all heard it, but coming from the administrations, Dr. Moore, what is hospice to you two?
Okay, so the definition of hospice, there's a technical definition, and then there is hospice and what hospice does for the patients and families. Hospice technically is for patients who have a terminal illness with a life expectancy of 6 months or less if the disease runs its normal course and they are not seeking aggressive treatment. Hospice is a lifesaver, though, if you really wanted to define it as far as for the families and for the patients. Hospice provides care in the home or wherever it is that the patient calls home, whether it be a nursing home, assisted living facility. But the care revolves around comfort measures, not around cure and not around what your diagnosis is. It's around what's bothering you today and how can we make that more comfortable for you. Mm-hmm. So you have a nurse in the home, social worker, chaplain, the aid services, doing the bath and the activities of daily living sort of thing, volunteers in the home, and just allows that patient and family to enjoy their remaining days at home.
Well, I noticed one of your slogans, for lack of a better word, it's not giving up. Mm-hmm. It's about taking control of the end of your life. And I think that's kind of the misnomer. Hospice is kind of a scary word. Dr. Morrow, I know you deal with hospice patients all the time. And as Kim talked about from a technical, what's it take to become a physician, that a hospice physician? Because both of you deal with death. I mean, that's really, we can, I'm saying clean it up, but we can kind of, yes, it is my father went on hospice. It was one of the greatest experiences of, unfortunately, at the end of his life, but nothing, he had kidney cancer, and the cancer, unfortunately, had metastasized to his pancreas. And anyone who knows that from a medical standpoint understands that's just not something that's good. And he had a choice to fight it, and there were not very good odds, and unfortunately, the end of his life could have been a lot more painful, or he could use, much like what we're talking about from a hospice standpoint, and
embrace it.
And embrace it and choose, this is how I'll die. And it was wonderful. We all could be together. And he slowly, eventually went into a coma. And Dr. Moore, I know you see that with patients.
Yeah, hospice allows patients to really, pass in dignity, and it makes sure that everything is taken care of for them. Gives them the resources, the nursing staff, so that the family doesn't have to worry about that. The family doesn't have to take them to a physician office for pain relieving treatments. It's all brought to them. And I've seen positive outcomes with hospice, and I've seen negative outcomes with hospice. I've talked to patients' families after the patient passes, and I've had patients who have had very good experiences. I've had patients who have had bad experiences with hospice and without hospice. And so the point of hospice is really to try to bring as many good resources together and to use, a reputable hospice, a hospice like Tuomey Hospice that really is in there to provide the resources the patient needs. I mean, the resources that Tuomey has, the staff that they have, they are there for the patient. They're there to provide whatever resource they have at any time of the day or night. And you talk to these hospice nurses, and they get calls at 2:00 in the morning, and they are there.
Yeah.
2:00 in the morning on a Saturday night, and they are there. And when it's time for the patient, when they're at terminal hours, the staff is there, and they're there to take care of the patient, and they're there to take care of the family.
That's wonderful. It's a great service. And, as we come up here on a break, we also, with Tuomey, what I think that we want to get out to everyone listening, Kim, is also there's other avenues that are very similar and sometimes confused with hospice, from palliative to bridge. And we'll talk about that. And as we close this segment, we want to remind everyone, show, of course, airs Saturday from 10 to 11 every Saturday. And it re-airs Sunday from 2 to 3. And next week's guest, Karen Schwartz, will be talking to us about all the Obamacare, Affordable Care Act, and all the things that we have to look at with them. So we'll be right back, and we look to talk more with Kim and Dr. Moore with Hospice.
Back with more on Medical Forum, presented by At Your Service Home Care.
Reliable Medical Equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street. Voted Best Prosthetic and Orthotic Business for 7 years.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When your policy comes from us, it comes with something extra, a real person. Don't buy from an insurance company with an 800 number and a voicemail menu. Auto Owners Insurance operates exclusively through local independent agencies here to help you with all your insurance needs 24/7. Now that's a good policy. This is Ed Bynum with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
After my surgery, I heard my children discussing their fear for me to live alone. I wasn't ready to give up my home and freedom, so I called At Your Service Home Care, and now I have my own concierge. It's owned locally by medical professionals. They work with me to make sure that I recovered from my surgery. Now I can stay at home and I have a new friend that I enjoy spending time with. If I need help around the house or have insurance or legal questions or just getting to my hairdresser, they help me with it all. Call At Your Service today for your free consultation, 607-9677.
Now back to Medical Forum, presented by At Your Service Home Care on WDXY, 1240 AM and 105.9 FM.
And we are back on this Saturday morning. I want to thank my guest, Jeff Fall from Tuomey Foundation, and, of course, Kim Price, Administrative Director of Hospice. Also want to thank our many sponsors, At Your Service Home Care, Reliable Medical Equipment, Medi Home Care, Tuomey, all of Tuomey, from your surgical unit, home health, hospice, and everyone involved with that. So I want to thank all of our sponsors, as I say, for bringing the show to the air. Kim, when we left, we had talked about hospice, and I hope we cleared up a lot of misconceptions, or at least informed people of what hospice does. Which, as Chris pointed out with Tuomey, and I want to say this on a personal note or a business note, and there are now about 19 different hospices in this town. I would say do your research, but Tuomey is the only one that, and we can talk about the bridge program, we can talk about the palliative program, but I would tell you to be concerned, do your research. There are a lot of people out there, and this is a very serious subject. And I think Chris, you and Kim could probably give more information. There might have been 4 or 5, 6 years ago. People are opening up hospices that I would say probably shouldn't be. And I think some people are being put on hospice that probably shouldn't be. So if you want to speak to kind of that, and I know you want to, you're a total professional, want to talk about all the services and what makes you guys best, but maybe give some people some fair warning, either one of you on that. You've seen so many of these hospices come out of the woodwork.
I think the biggest thing, and for me, if I had a family member signing up for hospice, there's a couple things I'd want to know, and that is where do your nurses live and reside in perspective to where my loved one lives and resides? How long is it going to take you to get to me on call? There are some hospice offices here in town, but there are some hospices that serve Sumter County that their on-call staff is not in Sumter County, and they don't have an office in Sumter County. Or they might have an office in Sumter County and they group up with their other parent or partner hospice groups. So they might have hospice in 20 different counties and they cover call as a group. So your on-call nurse might very well be in Charleston when you need them, and we know how long that takes. So I would find out about their on-call, and I would also find out about their ability to provide inpatient hospice services. All hospices provide it. I would ask where they provide it, because even hospice patients have symptoms that sometimes are difficult to control at home. And we are blessed at Tuomey to be able to say, you know what, we've done all we can at home. I know you want to be home, and we're going to get you back here, but we need to get you into the hospital, in the facility, get these symptoms managed, and then get you back home. So we bring them in for what's called inpatient hospice, get that symptom managed, and then get them back home.
Well, talk to that a little bit, because I got to believe that you're the only one who has the capabilities to do that. Mm-hmm. So if I'm at home, I'm on hospice, but my symptoms have, for lack of a better word, they may be short-term, but they've gotten worse.
They've escalated. Mm-hmm.
They've escalated. You have the ability to put me back in the hospital.
Under hospice.
Under hospice, so nothing changes.
Not going to the ER. Ambulance transport straight to a bed in the hospital.
And then with the hopes, of course, is then to come back to your environment. Because I think that's the thing with hospice. You get to stay at your house. I think, Dr. Moore, you talked about that.
Well, I would say a lot of these admissions for hospice, inpatient hospice, most commonly I see is a pain management issue.
Absolutely.
So something to that effect. And so, it's just you can't manage it at home. And the patient might be using pills or patches. It's just not working. And so they might go into the hospital for inpatient hospice, a pump, a PCA pump, a patient-controlled analgesic pump, or just a analgesic pump is begun. And I see that a lot. And you fix the problem and you get them right back.
Right.
And again, Tuomey, it's seamless. Mm-hmm. It's seamless. Mm-hmm. So, Tuomey Hospice has this ability to just get them in, get that problem fixed, and get them back home, which is where everybody wants the patient or client to be.
Well, and I will say that all hospices have the ability to provide inpatient hospice. That's part of the requirement of being a hospice. It might be in a nursing home or in a hospital in another town. I think some work with Clarendon Memorial Hospital. Tuomey does not right now. However, I will say we have said with the hospice house, the Festival of Trees, those funds have always been geared towards Sumter's community having a hospice house. But Tuomey Hospice realizes that we don't have the census to support a hospice house all on our own. So when we do the hospice house, when that comes to light, and it will come to light, Palmetto is behind the hospice house, we will be looking to share that hospice house with other hospice providers to be able to service their patients as well. We've always said that because it is that Sumter as a community needs a hospice house. It's very difficult to let other hospices into a hospital setting because there's so much that goes on in that setting, and things can go awry really quickly during the night, and you've come back as the hospice in the morning, and all of a sudden your patients had CT scans and X-rays and MRIs, and you go, what happened here? Why are we doing this? They're not hospice nurses in the hospital. That's not what they've trained to do. So as the hospice, we're always in there trying to guide them and help them. And we don't always talk on the same page, so it's a constant effort. So in the hospice house, you will have hospice nurses who understand hospice, and that's why the hospice house is so desirable. People say, well, why can't you just do it in the hospital? Those aren't hospice nurses. That's
Right.
not what they've signed up to do. So
Right.
my dream is to continue Festival of Trees and the support for hospice until we can get that hospice house and have that environment where we can.
And judge about that on the times that he's been on there. What do you know anything about the progress that's being made towards the hospice?
I just know that we continue to raise funds. I have been told that Palmetto is behind the hospice house. They support it. So there's no fear of Palmetto coming in and going, you really don't need this hospice house. So I just continue to do my due diligence to, try to raise funds for hospice and support. I speak to different hospices. Some of them have even come in and asked about doing inpatient hospice in the hospital. And I get it, and I understand that they want to do that. But I also understand, that we have nurses in the hospital that that's kind of scary for them. It's not something they do on a day-to-day basis. And I support 100% other hospices being able to use the hospice house because they will specialize in hospice care. But I just keep trudging along. I see it coming to light in the next couple of years.
Great.
And I'm
Great.
excited about it. We have a little picture of it, a little rendition of it.
And where would it be located? Right across from the hospital?
Right across the street from the hospital.
By the
corner
museum,
there.
right?
Yes.
Okay. By is it Wells Fargo still? I don't know that bank.
Where the
right in
monument
between.
is, in between, is that Hampton and
Yeah.
North Washington?
So very convenient to the hospital as well. Kim Price with us from Tuomey Hospice. We're talking about hospice. And Kim, as we come up, we got about a minute in this last break. Let's talk briefly about the palliative care that you also offer. And then as we come back out of break, we'll talk more about it.
Okay. Palliative care is all of comfort measures. So not everybody that needs palliative care is ready for hospice. But they're still, they still should be able to have some palliative care, some comfort measures.
Okay.
So that's what palliative care is.
Well, we're going to talk about palliative care as we come up on our next break. I want to thank again all of our sponsors at Your Service Home Care. Stop by 1250 Wilson Hall Road, 607-9677. Reliable medical equipment for all of your respiratory orthotic needs, 934-9212. And Bynum Insurance as well. And we'll be back right after this.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
After my surgery, I heard my children discussing their fear for me to live alone. I wasn't ready to give up my home and freedom, so I called At Your Service Home Care. And now I have my own concierge. It's owned locally by medical professionals. They work with me to make sure that I recovered from my surgery. Now I can stay at home and I have a new friend that I enjoy spending time with. If I need help around the house or have insurance or legal questions or just getting to my hairdresser, they help me with it all. Call At Your Service today for your free consultation, 607-9677.
Reliable Medical Equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street. Voted Best Prosthetic and Orthotic Business for 7 years.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When your insurance policy comes from us, it comes with something extra, a real person. Don't buy from an insurance company with an 800 number and voicemail menu. Auto Owners Insurance operates exclusively through local independent agencies here to help you with all of your insurance needs 24/7. Now that's good policy. This is Bubba Johnston with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
This is Medical Forum, presented by At Your Service Home Care.
And we're back with Medical Forum for our last segment. Remember that we air again on Sundays from 2 to 3. I'd like to thank our sponsor, MSA Medical Services of America. represented in Sumter with Medi Home Care. DME is located on Boltman Street. Their hospice and home health services are located at 2560 Tahoe Drive. And the phone number over there is 803-905-7720. Kim, we were talking about hospice and the hospice house that is we're working on funding now, and money is being raised for that, which would be a tremendous asset to Sumter. I've seen hospice houses in other locations. Matter of fact, we were walking around Beaufort, South Carolina one day, my wife and I, and walked into what we thought was a bed and breakfast. Beautiful home, gardens, and thinking that we were going to.
Well, it is.
It is a bed and breakfast.
Some people stay there.
Yeah.
And lunch.
They will
and
serve
dinner.
you breakfast.
Exactly. And it was a beautiful home. Yeah. It was a beautiful home, and we thought how nice of a place to stay on our next trip. And we went in, and it was a hospice house.
Uh-huh.
But my point of that is how wonderful of an environment it was, how beautiful of a place. I would have loved to have stayed there.
Short term.
They are beautiful.
Yeah, short term.
They are.
And to have something like that in the Sumter community would be a tremendous asset. And again, the goal of Tuomey, from my understanding, is to build this for the community, not for just Tuomey. So other hospices will have access to it, which again is just going to improve the lives of the Sumter residents.
It is. And you do have people that will say, well, why can't we just do a unit at the hospital? And if you've ever been in a hospice house, it is nice to be surrounded by people that are absolutely going through what you're going through.
Yeah.
And while you don't mind on a normal day of the week dealing with, the family that just had surgery that wants to party in the room next to you, or, the family that just had a new baby boy and they're excited. But when you're losing your loved one, it's tough to tolerate.
A hospital is a high stress environment.
It is.
Period. It doesn't matter. It doesn't matter if you're a patient there.
Yep.
If you work in one, you get used to that environment, but it doesn't mean it's not stressful. And there's beeps, and there's rolling carts, and there's noises constantly, 24 hours a day.
And a hospice house is a sanctuary.
And a hospice house is not that. Yeah, absolutely.
It makes all the difference in the world. If you can't be home, there's no better place to be.
I agree. And so, but the hospice house in Beaufort is beautiful, and you can use that between now and then. I didn't get to try the food. I didn't try the food.
Did they have a spa?
They didn't have a spa.
And we're not making light. I think it just speaks to I've been in two. One was a log cabin up around the Columbia area. It was just beautiful. You felt like, and I'm sure for the patients in there, and you hear the old phrase, misery loves company, and I think that's kind of what you guys are echoing here. In a hospital, it's kind of carte blanche, from someone having a newborn baby to someone having minor surgery or major surgery or death. But in this environment, everyone has one common theme, and that's where we are, as you said in your quote, we're controlling the way we end our life, and we've taken those steps, and we're going to be around people who have also done that. And
great support.
Yeah, very good. Well, I know that Tuomey also offers a palliative care. Now, to the layman out there, palliative care is what?
Palliative care people struggle with, because even in the hospital, and ours is strictly an inpatient palliative care. My hope is to one day have an outpatient palliative care for our community as well. But we do inpatient palliative care, and physicians as well as patients, they hear people go, I'm not dying. Well, palliative care, hospice is a form of palliative care, but palliative care, just the goal is to manage symptoms. So even if you are a COPD patient or a respiratory patient, I don't using my technical terms, but a respiratory patient, and you're struggling to breathe, palliative care has the skills to help you manage those symptoms. Whether it's a low dose of morphine, which people think morphine for respiratory, absolutely, a very low dose of morphine can take away that air hunger. So palliative care is a comfort measure treatment, if you will, for all patients who have symptoms. Hospice care, palliative care for patients who are terminal, 6 months or less to live. But who is to say the cancer patient who has 2 years or less to live doesn't deserve palliative care as well, doesn't deserve to have their symptoms managed? So palliative care really works on symptoms.
Now, you have a bridge program.
We do have a bridge program.
Okay, so talked about hospice palliative bridge. What's a bridge program?
We use our bridge program for patients who have a year or less to live if the disease runs its normal course. And it essentially is to bridge patients into hospice. You could have 2 months or less to live, but you haven't embraced it yet, because remember, that's a big piece of it, is no longer seeking aggressive treatment. So let's say we have a home health patient or a home health referral, and we can tell that this patient is a terminal patient and they just have not embraced that yet. Bridge might be a better fit for that family so that we can then bridge them into the hospice program. So Bridge is more geared towards having those conversations about goals of care and where we're headed.
Well, one of the things we always talk about, because it's the topic always, does insurance pay for this? So let's talk about hospice, bridge, palliative. First question, who determines the physician-driven? Is this patient-driven? Is this diagnosis-driven? How do we get put into one?
Okay. Bridge for us, for Tuomey Home Health, is a home health program. So insurance does pay for home health. It is just a caveat for patients who have that year or less to live that we want to try to steer towards the hospice environment.
If I have Medicare, will you use the red, white, and blue card?
Pays for it 100%.
Gotcha. For as long as the need?
Well, home health as well as Bridge are short-term programs because it is a short-term program.
Okay. So there's a time frame. So I go from Bridge, Medicare's paying for it, the need is there, doctor, patient, everyone's in agreement. Palliative.
Palliative care for Tuomey right now is an inpatient program. We do not have a physician seeing patients. It is strictly a nurse, social work, chaplain program. The physician or a nurse practitioner would be able to bill for palliative care services.
Okay.
While we don't have that piece right now, we are not billing for that, but it has been a great service.
So if I have Medicare and palliative care is the choice that has been devised for me, it is something that insurance covers.
So correct me if I'm wrong, Kim, palliative care is almost like a consult.
It's like a consult.
It's like you're in the hospital and you're receiving care, but just like any other area where you may receive a cardiology consult, a pulmonology consult, an orthopedics consult, a palliative care consult is a team that is specifically trained in treating patients with end-of-life issues.
Okay. So where hospice
symptom issues
takes over all that responsibility, the physician, the medicine, the care, and such. And I know we've got about a minute left. So with hospice, though, that's where it differentiates palliative in a way.
So your palliative care, Dr. Marr might be seeing you for your COPD. The hospice physician, let's say it's Dr. DeBose, is seeing you for your shortness of breath. They can both bill that.
Wow.
Because it's a symptom code and a disease process code.
Kim, we're coming up short on time as always, and a lot of information given and a lot more needed. How do we get a hold of you and your great staff on Pinewood
I would
Road?
be failing if I didn't tell you that hospice is paid for by Medicare 100% as well.
Awesome.
And you can reach me at 803-773-4663 at the Home Services Office.
Okay, Kim, it's always great to have a great rest of your weekend.
You as well. I'd like to thank Kim for coming on, and I'd like to wish her my prayers for the tree.
Thank you.
And
I'll take all the prayers I can get.
The 30-foot tree. I hope you don't have to see
We'll
Dr.
see y'all
Ford.
next week, and hopefully we'll see Kim for a long, long time.